Hey, you guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review books, courses, videos, and more to assist nurses and nurse practitioners with success on exams, boards, as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with a 99% pass rate in all of our comprehensive reviews and a 100% pass rate in our one on one sessions. If you need me, I'm here. Let me know. I would love to work with you. But I always like to get into my disclaimer and reminder before getting into our questions. There's no absolutes in medicine. We treat on a patient by patient basis. And so any of these questions that I have designed and I provide to you guys are based on the guidelines that are currently being tested on the ANCC as well as AAMP exam. Now, any of the videos that you may see that are talking about things that we commonly do in practice, I will always say that because there's a variance. So that um, from practice and what's currently being tested on some areas. So I always will include that so there's no confusion, okay? With that being said, let's get into question number one, you guys. All right, question number one states the nurse practitioner and NP student are discussing hypothyroidism. The NP student is inquiring on how often they should assess the TSH level after synthroid is initiated. What is the appropriate response by the nurse practitioner? Is it A, every 4 weeks? Is it B, every 6 to 8 weeks? Is it C, 90 days? Or is it D, 10 to 12 weeks? Take a moment and tell me what you got in the comments. All right, you guys, I always recommend reading the stem of the question first, right? So it allows you to slow down and ensure that you're answering what is really being asked, right? So this stem states, what is the appropriate response by the nurse practitioner? So let's see what they're even talking about. Nurse practitioner NP student are discussing hypothyroidism. The NP student is inquiring on how often they should assess the TSH level after they have initiated Synthroid. All right, so this is a knowledge based question, but the best answer is B. You want to assess that TSH level every 6 to 8 weeks to gauge that whether or not we need to adjust the Synthroid dosage, okay? So every 6 to 8 weeks. All right, you guys, question number two. The nurse practitioner is completing her assessment and has diagnosed the patient with rosacea. The patient states that she has used topical agents in the past without any improvement. Based on this information, how should the nurse practitioner treat? Is it A, topical flagyl, B, oral tetracycline, C, Accutane, or D, nothing at this time? Continue to monitor. Take a moment and tell me what you got, you guys. Tell me what you got in the comments. All right, so similar question states based on this information, how should the nurse practitioner treat? So, if we're talking treatment, we got to run it back and see what the diagnosis is, right? And if they haven't provided you with a diagnosis, you need to take it a step further, see what the assessment findings are. How are they presenting, right? What are the signs and symptoms? What assessment have we done to reach a differential diagnosis to even be able to treat, right? So, I always tell y'all just picture the person in front of you. So here they have provided the diagnosis, let us know that she has rosacea. The patient states that she has done topical agents in the past. So when you think about treatment for rosacea, we know that we do topical agents like your topical flagyl, but she's done topical agents in the past and haven't had improvement. So also with rosacea, you can give oral tetracyclines. So at this stage, it's best to go with B, oral tetracyclines. If we hadn't tried a topical agent in the past, you can go topical flagyl and oral tetracyclines. Those are your best treatment options for rosacea, okay? All right, and lastly, question number three. The nurse practitioner notes discoloration to the back of the patient's neck. It is darker in color. The nurse practitioner diagnosed the patient with acanthosis nigricans. What next steps should the nurse practitioner take based on this diagnosis? Is it A, monitor the patient's thyroid function? B, monitor the patient's kidney function? C, monitor the patient's blood glucose and manage accordingly? Or D, monitor the patient's blood pressure and monitor accordingly? Take a moment and tell me what you got in the comments. All right, you guys. So, STEM the question states, what next steps should the nurse practitioner take based on this diagnosis? All right, so what's the diagnosis? If you look back, it says that the nurse practitioner diagnosed the patient with acanthosis nigricans. So, you need to first understand what that is, right? So, just as they said, the patient came in with discoloration to the back of their neck. That's commonly where it's seen, but there can be like discoloration to the crease area in the back of the neck, darker in color. And this is a classic finding of uncontrolled diabetes. So you want to see, monitor the patient's blood glucose and manage accordingly. Also, you guys, I always recommend with different derm presentation and things, and diagnoses, Google images of those so you can visualize it. Don't just sit over here and listen to the words of what I'm saying or just read it, because sometimes we start to form an image, but tie it to something. Lay your eyes on it so that you can get a better depiction, a full idea and visualization of the term and the diagnoses, right? So again, best answer is C. You want to monitor that patient's blood glucose and and manage accordingly. Okay. All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But you know what to do. Make sure you meet me back here. And as always, if you need any of our resources, give us a call at 803-400-6864. You can also shoot a text message to this number or shoot an email to the nursing studio, the number one at gmail.com. Now, a few rundown of the list of what we offer. If you need a review book, there is the ebook option, and then there's the paperback option that can be shipped to you. Both are linked in the bio of this channel that you can easily access, along with the website link as well. We offer self-paced review courses that you for our FMP and AGMP reviewers, you're able to do this to prepare for AAMP and ANCC. It is a monthly subscription. You can cancel at any time, and it's broken down by system, including the non-clinical section, because it is designed to prepare for AAMP as well as ANCC. There are many questions, many quizzes associated with each of those systems. There's images, there's a downloadable and printable workbook, PowerPoint associated with it as well, so that you can follow through and go through it. I'm teaching in these videos with the PowerPoint on the screen as well, so that you can walk through it with me. Okay. And then we have our 5-week course. That it starts, the next one starts June the 10th. That enrollment is still available. um, for that, it is 5 weeks of assignments broken down, structured studying. We work together. We do weekly live practice questions, and then we have the final week of individualized review and assessment and advice based off of your assignments that you have submitted, your progress, and your exam readiness. We had discussed this and talk next steps after the course, okay? And then lastly, we have one-on-one sessions. So if you have a particular weakness that you want to spend time working on making it a strength, that's an option of our one-on-one. Or we have a one-on-one custom package that commonly people use, like if they've been unsuccessful previously and are looking to prepare to retest. We focus in on what your weaknesses are, structure a study plan, work along with you over the duration of time that you want to allot to study and to prepare again, and then we work with you to get you to successful on boards. Okay, so if you need any of those things, like I said, give us a call at 803-400-6864 or shoot us an email at the nursingstudio1 at gmail.com. But as always, meet me back here. Happy studying. Bye, y'all.